Hi, I'm Dr. Erin Ducat, a chiropractor here in Bloomingdale, Illinois. A lot of patients come to my office and complain about their posture. They've been fighting it for years. It seems to affect the way they feel, the way they move, causes a lot of pain, discomfort, and they're really frustrated by it. They also sometimes, have been doing a ton of shoulder stretching, shoulder strengthening exercises, things that they've looked up on YouTube, etc., that are supposed to be great for posture, and they feel like they really aren't getting anywhere. One of the first things that I'll do with those patients is to evaluate, is their posture problem coming from their shoulders or is it coming from the spine? So this middle part of your back from, about here to here is called the thoracic spine. And it's formed of 12 different vertebrae that each vertebrae connects in with a rib. And then that rib wraps around, connects here in the front to your sternum, and that creates your rib cage. Now this area very often gets tight, gets locked up, and gets stuck in what we call a kyphotic position. I know it's a big doctor term. Kyphotic position or kyphosis means that you're stuck hunched forward like this. When the thoracic spine, the rib cage, gets stuck in kyphosis, it doesn't like to extend, and it also will have difficulty rotating. Extension and rotation are what we call coupled movements in the thoracic spine rib cage area. In other words, they work hand in hand. If you can't extend, you're not going to be able to rotate. I can guarantee if you can rotate, you can extend. Okay, so those two things go hand in hand. Now, if your thoracic spine and rib cage is stuck in a kyphotic position, you can stretch your shoulders until the cows come home, and it's not going to fix your posture. Okay, so again, you can stretch your shoulders all you want, but if the posture problem's happening in your thoracic spine or rib cage area, stretching your shoulders aren't going to help. Now, sometimes your posture problem could be coming from the shoulders as well. Most of the time, I can't say all the time because I haven't looked at every patient that's ever been out there, but most of the time, if someone has shoulder mobility problems or shoulder strength problems that are causing posture issues, it's secondary to the thoracic spine and rib cage. Okay, I don't really think I've ever seen a case where it's just a problem in the shoulders and not also a problem with thoracic spine and rib cage. Now, an easy way that you can start to evaluate this at home is by using a wall. This is actually a technique that I use here in the office quite frequently. You just stand up against a wall like this, and your feet should be within about a maximum of 6 inches from the wall. And if you can get a little bit closer, that's great. And here, let me take my butt out. It's in my way here. So when you're analyzing your posture, you should be able to have your tailbone touch the wall, your middle back, or if you're female, where your bra strap is, that should be touching the wall. And then the back of your head should be touching the wall. And then your eyes should be level with that horizon. You shouldn't be tipped up like this. You should be nice and level. Now, in addition, your shoulders should also be able to touch the wall. So if I kind of rock my shoulders back, I should be able to get my shoulder blades nice and flat against the wall like that. I've got pretty good posture. Let's hope so, given that I'm a chiropractor. Now, if you go up against the wall and you notice your spine is touching, but your shoulders aren't, that means you need to work more on opening up the shoulder mobility, as well as shoulder strengthening in the back. If you feel like your spine isn't quite touching the wall, like maybe your upper back can't touch, or maybe to get the shoulders back, you have to kind of arch, your rib cage like this, or perhaps your neck is kind of having to tilt up like this in order to touch the wall. That's an indicator that you're having problems in your thoracic spine and rib cage. So in order to fix your posture problem, you've got to first fix that thoracic spine and rib cage. Once that's resolved, then it's time to address whatever's happening at the shoulder. If you flip those two things around, either you're going to be very frustrated and not see progress, or you can possibly overstretch your shoulder, causing injury to the rotator cuff or the labrum in your shoulder, and that's never a fun thing. But if you need help with your posture, need someone to pinpoint where your issue is and give you some guidance on how to fix it, whether that's your hands-on chiropractic care or exercises that you can do at home to get better, let me know. I practice here in Bloomingdale, also practice virtually throughout Illinois, and my website's ducatchiropractic.com.